Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. I'm excited today to be talking about the kidneys. In fact, this is the first podcast I've done on Rational Wellness about kidney health, and we'll be speaking with Dr. Robin Rose. The kidneys filter our blood to remove waste products such as creatinine and urea and extra water, and remove them through the urine. The kidneys have other important functions, including removing acid, balancing electrolytes like sodium, calcium, phosphorus, and potassium, regulating blood pressure, helping to produce red blood cells, and converting vitamin D into its active form. Chronic kidney disease is a long-term condition where the kidneys gradually lose their ability to filter waste products and excess fluid from the blood. Most doctors monitor kidney function by monitoring the estimated glomerular filtration rate, also known as GFR, which is usually considered problematic or abnormal when it goes below 60. But the reality is a GFR of below 60 actually represents stage 3 kidney disease. Full kidney function is with a GFR of 120 or better, and a GFR of 90 to 120 is considered stage 1. GFR of 90 to 60 is considered stage 2, which I don't think most people are aware of. So, Dr. Rose, thank you so much for joining us, and let's talk about kidneys.
Thank you. Thank you. I love having this conversation. I think of kidneys as a root cause, actually. It's so insidiously connected with everything else. You know, we think of filtration, but that's only the first step. The downstream from filtration abnormalities is this crazy array of problems that actually do start showing up in stage 2. You know, like you say, GFR of 60 is you've already lost 50%. It's crazy to wait that long. And
what do you think it is that basically doctors say everything over 60 is fine?
Well, you know, I think long ago, we didn't have any labs. And so by the time you figured out what's going on with kidneys, it was pretty advanced. Yeah, and okay, you know, we started looking at BUN and creatinine. That added a little insight, but it's still not very precise. When the GFR showed up, I wasn't there for that decision making. I think it has to do with, I may have to let my dog off its leash. Hang on 1 second. I apologize. My apologies. A rescue dog who chases everybody home. Anyway, there aren't medications really. And so I've heard that said. It's like, well, we don't really have a way to treat it. So you don't want to tell people they're sick when you have nothing to offer, which is where I come in. And I actually renamed what I do renology, which is the art and clinical science of kidney success.
Okay.
You say those words, the limbic system lightens up. Because kidney failure is like way down the line.
Right.
And so, you know, this decline that we see, it starts in stage 2. I mean, it's so cool to realize this. The first thing I started learning about was uremic dysbiosis. That starts in stage 2. There are a lot of toxins. I mean, you know, the filtration includes filtering toxins. Some the body makes, loads that we get from the environment. And so, ultimately, we have to be aware of what's going in and how do we get rid of it?
By the way, why is GFR estimated glomerular filtration rate? Is there a way to actually measure GFR without estimating it?
There is, but it's complicated and nobody does it.
Okay.
So it's basically a formula that somebody smart came up with.
Right.
And there's also cystatin C, which doesn't use creatinine. And that's a whole nother conversation because creatinine, like a very bulky person is going to have a higher creatinine, but that doesn't mean their kidneys aren't working. A very skinny old somebody may not have much muscle, so their creatinine's low, and it makes it look like their kidney function's normal. So, there's play in this wheel. But anyway, so there's uremic dysbiosis. That's a huge conversation and hugely important. And then there's endothelial damage. That's enormous with kidney disease. And, the cardio decline because of kidney is some 30 to 100 times more than someone without kidney dysfunction. So, it's a real relationship. And then mitochondrial.
What is uremic dysbiosis?
All of these nasty things that harm kidney ends up in the gut. It's a whole conversation that I'm probably going to have tomorrow because I'm doing a talk with a gastroenterologist about kidney gut relationship. But the truth is these toxins cause leaky gut, damage the way the gut works.
Is there a microbiome of the kidney?
Yeah, oh, absolutely. And the gut microbiome alters. And then with leaky gut, it's going through, getting in the blood and harming kidney. Once things are in the blood, so inflammatory mediators from the gut, that might be a result of phosphorus, for instance. Phosphorus is a uremic toxin. For people who have healthy kidneys, phosphorus is a lifesaver. But when it starts elevating, that's a problem. And the problem in the simplest form is it sucks calcium from the bones and places it in the arteries. Two severe problems that happen as kidney disease advances. And so
if you have leaky gut, can you have leaky kidney?
Yeah.
Interesting.
I know. I love saying that too.
Is there any way to measure kidney dysbiosis or kidney leaky gut? Or kidney leaky kidney?
Leaky kidney. I love that. Basically, a lot of it to me has become intuitive because the lab work isn't that good. The tubules are what gets harmed first. And learning about tubules is an adventure. Like the small intestine, it's responsible for things coming and going. And so the tubules are the discernment. What do we keep and what do we get rid of? Toxins in the world that we ingest end up harming the tubules. The mitochondria are in the tubules. When that starts going, the energetics of kidney isn't working well. Things that you're supposed to keep get excreted. You see protein in the urine that shouldn't be there. And, things like sodium are brought back into the system when they should be excreted. And so, it's complicated. And yet there's some simple guidelines and some simple remedies to use to reclaim, particularly early. If you start in stage 2, there's a little digging, taking a history to really find out what portal did this person enter to get to kidney problems? Because there are several, there are many. And, we look at vascular issues, we look at neoplastic issues, autoimmune issues. And so the stuff that we know already as functional practitioners can be applied. And really, you use your typical dysbiosis testing and then do some repairs. I was reading about acromantia yesterday in regards to kidney function. Beneficial. I was told early on by Jenna Henderson, who's a naturopath who works with kidney, to do fermented foods as a daily, every meal issue, because you're providing good organisms that the gut will then have more ability to adjunct the kidney. You know, we talk about like intestinal dysbiosis. Intestinal intestinal dialysis. So, you know, you're using the gut to excrete some things because the kidney isn't quite as adequate.
Let's just finish with the testing first. You said that GFR may be problematic as a way to test. Should we use cystatin C? Is that a better test? Why are we still using GFR as the way to really decide where you are in this process?
Yeah, it's useful. You know, I mean, and you thought, you know, because this is a long haul issue, you can follow the GFR over time and see where you're going. A lot of it has to be intuitive. You know, I mean, you know, I didn't include my story. I mean, I'm one of the kidney wounded healers that I had kidney cancer, had a nephrectomy, woke up 3 months later with a GFR of 30 and basically got no good advice, and sat right here in my tropical paradise and started looking stuff up and basically evolved this concept. I lost a lot of weight. And so my creatinine was always super low. There's a discrepancy for me personally with GFR and cystatin C. Others, they're pretty consistent. So, you know, it's expensive. Sometimes insurance doesn't pay for it. So, you know, GFR still has value, but to be appropriate in the kind of precision that we like to be, you just have to know its faults, you know its strengths and know its weaknesses as a lab test. And because, you know, if you're dealing with the lifestyle aspects for kidney, which is really the first step, these are healthy things to do no matter.
So let's say I have a patient and we're still trying to figure out what's going on, whether or not they might have a kidney problem. Do I look at BUN? Do I look at creatinine? Do I look at uric acid? If those one or several of those things are slightly elevated, what do we make with that?
So we know that kidney affects all of these things. I mean, there's more. Parathyroid hormone, vitamin D is important. And I like the 125 because that's kidney prepares the vitamin D. And so, you know, you do a 25 hydroxy D, you're getting a liver marker. Okay. Phosphorus to me is very important. It's not really given the kind of credence that I give it in the conventional nephrology community, but I'm seeing more and more. It has a big role as a toxin. And early on, the lab doesn't look abnormal. However, during stage 2, already phosphorus damage is happening, even though on the lab it looks normal. And what I learned was 3.5 midline is when you start being concerned. And there are plenty of activities to do, actionables for people whose phosphorus is elevated. But here's another lab. I know I wander a bit, but the phosphorus issue is connected with calcium, 125D, parathyroid hormone, and something called FGF23. FGF23 may become elevated before the phosphorus. And again, you know, when you're looking at damage to bones and damage to blood vessels, that's serious stuff downstream. And so the earlier you start, the better. And some of that goes back to diet and lifestyle choices. So, you know, again, stage 2, we can do real simple stuff. And it helps to have abnormal labs to motivate people. Because otherwise they're like, yeah, I'm fine. I feel good. I don't care. But when you understand that, the beginning of a long story is where to be motivated, I find that guiding people to willingness to learn about the course of decline that you want to avoid. So, a year
now I read a review by Guppy and others in 2024 that healthy adults have a normal decline in their kidney function. I think between 0.37 and 1.07 milliliters per minute per year of GFR. And they speak as though it's inevitable.
I know. And, I had this lovely experience talking with a nephrologist and Joe Pizzorno on a call.
Okay. I know Joe.
And she brought it up that it's just what you said, that, well, the decline is inevitable. And I loved what Joe said. It changed how I think about this. We do not measure toxins, really. An elder has been exposed for many, many decades to toxins that are very likely nephrotoxic. That's what's causing the decline, not aging as a thing. And, I have a 70-year-old husband with a GFR of 100.
Right.
It's not inevitable. And so that's where my passion for the bioregulator peptides came from, because you actually can reverse the epigenetic damage and re-up the DNA production of proteins that can do some of these repairs.
How should we think about kidney decline if it does happen? Is it typically inflammatory? Is it more toxin related? What is it more typically related to when it does happen?
So that's what I said before. It's like there are many portals. Every case is really quite a collage,
right?
Unique. But so you think some people, the hypertensives that end up with kidney damage, the diabetics, the glucotoxicity, another insulin resistance, another pathway in. Toxins, absolutely. I think that was my story. Autoimmune is another one. Neoplastic is another one. And so, and genetics, there are genetic syndromes that harm kidney. And so once you know that, you get a good history, you're already doing some stuff for those underlying issues. Somebody's autoimmune, most of us know what to do, but all of a sudden it's like the attention to kidney changes things because the diet's a little different. The what the body will accept and use, the hormetic zone changes basically for what's safe and what may be too much or too little.
Right. Hypertension seems to be closely linked with kidney disease.
Absolutely. And, the other thing I wanted to say is every case indeed ends up inflammation, oxidative damage. It's kind of every case. And so that is got to work with those markers, with
and consequently addressing oxidation and inflammation is part of the reasonable preventative care for kidneys.
Absolutely.
So when it comes to managing chronic kidney disease, usually hear about you need to lower your protein intake. You need to lower your intake of potassium and phosphorus. Those are things people commonly talk about.
There's truth in the protein aspect of it. Again, every case is unique. It depends on what's going on, their blood type, their gut status.
So at what level of kidney function should somebody think about limiting their protein intake? Because understand, as people get older, there's a tendency to lose muscle sarcopenia, and there's a
Exactly.
tendency to lose bone, osteopenia, and maintaining reasonable protein levels is important to prevent those.
Yeah, exactly. And so, even in stage 2, the one thing that you want to know is there proteinuria? Because with proteinuria, you'd think, losing more protein, you want to eat more protein. But actually, what I found is 0.8 grams of protein per kilo can be acceptable for people in the course of improving function. At some point, you can nudge it up a little bit. But what I found is I have people doing 1.5 grams, lower them down to 1. They do much better.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration, and it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code WEITZ, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code WEITZ today. And now back to our discussion. Let's say somebody has a GFR of 75. That person, should they be thinking about restricting their protein intake?
At least to monitor, how much do you actually take in? And I personally did chronometer for a month. It's a total pain in the rear end to do it, weighing stuff. But what I found was half of my protein came from things like carrots, things you don't think of as protein foods. And it was like, so I was eating way more protein than I thought I was.
Okay.
And so, so that's interesting. And with a GFR of 75, I think, caution. How much? I guess it would depend on the person. Somebody really bulky is going to need to support that muscle. Somebody really skinny who needs to build up muscle also. And there's a thing that is interesting to me. Ketone analogs are amino acids that the nitrogen was taken off, and a ketone replacing the nitrogen being an issue with decreased kidney function. And so that way, you're actually getting the benefit of more protein without eating the more dangerous protein. You can also supplement essential amino acids. And for a lot of people, that makes up for the decrease in intake.
Now, what about lowering potassium and phosphorus? Is that something that really needs to be done?
To some extent, everybody should be aware of it. Maybe more closer to stage 3. However, check labs, because not everybody with CKD has elevated potassium. Some people have low potassium, and you're telling them, eat more bananas. Those who do have high, normal, or elevated potassium, there's such an easy fix. Bicarb.
Okay.
And I saw 5 nephrologists before I found this out myself. I mean, there are drugs that the nephrologists use for people to lower potassium. It binds up other stuff, and I find it a little bit demoralizing to do that to people. But, between magnesium citrate and sodium bicarb, you can really raise the CO2, which is the bicarb level. And it's amazing what you see. I mean, optimizing uric acid, potassium, phosphorus, PTH, all by simply using bicarb. And, the other thing is a plant-based protein helps. That's not to say never eat animal foods. Some people don't. There are some people who really do better without any animal foods. Most of us can be a bit omnivoric, but not overdoing red meat seems to be helpful. And that might be because of the acidification that happens. And so again, you can offset some of the concerns because kidney is quirky. It's just quirky. It's like stuff that usually doesn't matter, like, mid-range phosphorus. And so I don't think everybody needs to worry about phosphorus if they have kidney decline, but processed foods, get rid of them.
Okay.
There's the phosphates in synthetic food, I call it, is 100% absorbed. And
Right.
So that becomes a uremic toxin. Animal foods, it's about 80% absorbed. And plant-based proteins are more like 40% absorbed, and they have phytates. And so it's just, you monkey with the dials depending on the person that you're working with. Because first of all, if somebody utterly can't cope with not eating meat, work with it. Figure it out. How do we make this work for you?
So what kind of diet is best for a patient with kidney disease?
I think organic food is critical.
Sure.
Glyphosate is nasty about, in ways that really harm kidney. I think focused on more plant-based eating. So in other words, more vegetables, not excessive amounts of fruit because fructose has some issues, but, the fruits and vegetables, not so much grains. I'm finding that, the tendency for glucotoxicity with kidney disease means every meal doesn't have to have bread. Every meal doesn't have to have rice and noodles. More eating root starches, squashes and sweet potatoes and that kind of thing.
Now, if you're going to have more of a plant-based diet, you're going to have more potassium, aren't you?
Yes, and it's more alkaline, so there's a little bit of offsetting.
Okay.
And some of my passion about potassium is because my potassium has been elevated in the past, and I found out which vegetables were lower in potassium. I grow a lot of eggplant. It's a low potassium food. I've come to appreciate it. Arugula, which is a wonderful contribution because of the nitric oxide, the nitrates in it. Low potassium green, whereas I was guzzling kale. I was growing gorgeous kale and eating it every day. And, the consequence of elevated potassium isn't fun. I didn't feel good. I mean, I had neurologic symptoms, and I've seen that in other people. And just with a little messing around with their willingness, once the person understands why they're doing it, it's like, if you're driving a car and you're going off the road, well, let's turn the wheel back.
So when it comes to potassium, what you're saying is you want to monitor the serum level. Is that adequate?
Yeah. I mean, I think it is. It's good enough to say, we need to fine tune this more.
And what number of potassium, serum potassium, do you like to see patients with kidney issues keep below?
Under 5 for sure.
Okay.
And nephrology these days is saying, don't worry about potassium. It's not an issue. because there's a drug we can use if yours gets too high. I tend to be a little old-fashioned and more natural in my way of thinking. We can adjust the diet, and we can alkalinize, and we can do saunas and sweat things out and make sure we're peeing out stuff, by hydrating adequately. So there are ways to accomplish this.
Now, let's talk about nutritional supplements that may be of benefit for patients with kidney disease. And I would say my experience is that the prevailing view in the medical community is, as you know, that to begin with, supplements are ineffective and unsafe. And especially since the kidneys are filtering out toxins, don't take anything. The worst thing you can do is to take an herb or some nutritional supplement that's going to put more stress on your kidneys. So what nutritional supplements are beneficial for kidneys?
So can I do a sidebar and share the last nephrologist I went to see, I had started with a GFR of 30. I was alarmed. I mean, I felt awful. I felt sick. And so I went to see, I had to fly to another island to go see this person. By that time, I had actually gotten my GFR up to 51, which as a doctor, the first question would be like, wow, how did you do that?
Right.
Because originally I was told, don't be surprised to lose 5% a year. And I'm like, wait a minute. And so I wrote down my supplement list and I gave it, part of my history to this doctor. And she walks in and turns her back to me, starts messing around with her computer. And she turns around and says, you're taking too many things. And I'm like, oh, I feel like Susie Cream. She's like, oh, have you seen my labs? Yes, but I have not read about these things. So you're going to hurt yourself and you must stop. And I'm like, oh, I've read about them. Would you care for some references? No. So, that was a cameo for me that ended my relationship with nephrology. And after that, it's gone up to 68. Thank you to peptide knowledge, I think. And so, yeah, there are a lot of things. In fact, my next
talk about some of the nutritional supplements that can be beneficial for patients with kidney problems.
So I really love Nutrival.
Okay.
I've used it for years.
The Genova test, yeah.
And it has so much information and so much useful information for kidneys. So you find out there's quirky things and not in every patient. So, you can't assume, oh, well, your thiamine transporters are broken, but there's weird things, folate transporters, they go. So if you're seeing these abnormalities.
So that's like the organic acids part of the test.
The organic acid part, amino acid panel, B vitamins, you see things all crazy places, selenium, and so I like to base what I do on personalizing, and that's one way. I've been cowgirling it for years. I was doing holistic, whatever you call it, medicine years before functional medicine got named. I cowgirled it. I made stuff up and went along with it and problem solved and figured out things. And I think with kidney, it's kind of like that. You just have to see who your patient is. But yeah, B vitamins, I think, are really important.
Okay.
Zinc can be important. Magnesium can be important. Selenium, interestingly, has a quirky thing with kidneys, so it's worth knowing about. Iron gets messed up with some people, and so you want to follow iron studies. Things like quercetin and resveratrol are very useful. I have the tray with way too many things.
Astragalus. I've seen some data on astragalus for kidneys.
Yeah, that's the next project. I'm now calling that plant-based medicine.
Okay,
that's my next book.
What about phosphate binders like ferulic acid?
Important stuff, And again, I'd want to know if that person actually has the problem, because I shouldn't say nothing, but most things come with added either harm or benefits. And so you just want to know that. Things like chitosan. I really love Acacia Senegal.
Okay.
It's a powder. I recommend people start with a teaspoon and go up to 5 teaspoons and get hydrated well, because it can turn to cement in there. It is a butyrate enhancing substance, which is wonderful, but it also can chelate things like creatinine in the gut. Again, here we go with the intestinal dialysis. It assists that process. Things like, rhubarb can be helpful. There's a lot of plant. I walked around my property.
What about one of my favorite binders, modified citrus pectin?
Absolutely. And it's worth doing, finding out the galectin status.
Right. Galectin-3 is an inflammatory marker.
And TMAO, trimethylamine oxidase, another one, and ADMA also play a role in the cardiovascular decline, and also homocysteine. So, some genomics really helpful.
Right.
And again, you're going to do all of this on every patient? No, you got to be an intuitive clinician to know, with you, I want this. And so, the cardio portal people, all these things are essentially useful tools to keep folks. I know you were the one, you posted something just before about ACE inhibitors and hydrochlorothiazide. It's like, okay, here's kidney disease and reasons why, like aged garlic extract, endocalyx products.
Like arterial cells, say.
These are really, they're precious.
Do you have a favorite kidney combination product?
Not really. I tend to like to weave all, it's like, again, I'm such an obsessive personalizer that, the list of botanicals is crazy long. I walked around just my property, not that big of a property, writing down all of the medicinals that either are indigenous or that I'm growing, planning to materia medica that for kidney, because a lot of these things, they're amazing. And, the like you say, it's like, don't do it. But there's a lot of literature it's really supportive. And, it's like, if you know the pathophysiology and the pharmacognosy of the plant, and make sure, like certain plants aren't safe. Cat's claw isn't safe for kidney. Starfruit, too much oxalate. So you got to know that stuff. But, to make that crossover, I'm going to use Java tea in this patient. Cat whiskers. It's a really good. I just got some. I got some and I'm planting it.
Okay.
I'm into growing medicine. And so it's part of the diet, really. So I'm trying to articulate that now for this next project that I'm doing, because, the anti-botanical medicine force, especially in kidney medicine, is huge. Though they do support turmeric. That's a good one. Ginger is fabulous. Galanga is fabulous. I just planted cardamom. I live in Hawaii, so I can grow these things really well.
Cool.
Cardamom is amazing medicine. I started taking notes and looking this stuff up. It's so amazing. The senolytics have a place. It's definitely a senescent condition.
Okay. What would be your favorite senolytic for kidneys?
Safe quercetin and fisetin.
Okay.
They're not that effective. I actually personally used Foxo4 dry and had an enormous herx, which scared me because I'm here in Timbuktu by myself. And then 3 days later, I hadn't felt so good in a decade.
And what was this that you took? Say it again.
It's a peptide called Foxo4 DRI dry.
Okay, so let's go into peptides. First of all, for those who don't know, what is a peptide?
A peptide is a little tiny fragment of a longer, bigger protein. So proteins are big and they're wound up in certain ways. And people have discovered, smarter than me, people who are chemists figured out, like, if this is the whole protein, this little piece here is the active ingredient. And so they've been able to separate those out. And when somebody says, well, I don't know what peptides are, insulin is a peptide.
Yep.
Many of them have to be injected because if you take them orally, they get broken down and they just become amino acids, which aren't of no use, but there's something about peptide bonds. So when you take, a few amino acids and hook them together, some other chemistry happens that's powerful as medicine. And so for me, it was, thank you, Beth Shirley, who introduced me to BPC 157 because it enhances nitric oxide, which in kidney, it's in the pooper. And that may explain why it's such a vascular disease. Kidney is a clump of blood vessels. And so I was struggling to get my nitric oxide level up, and somebody else it might have been in your group, or maybe Sean. Anyway, it was interesting because as soon as I heard that, I had one of these head spin moments and was like, I need to know about this. Spent a month reading like a maniac, got some from a compounder. The first time I did a sub-Q injection of it was like changed my life. Damage that I'd had from my surgery was gone in a day.
Wow.
And I was like, I got to learn about this. And so that was the beginning for me, studying with different teachers. But what I was doing was really looking at the, it's getting windy all of a sudden. Tell me if it's too noisy. Looking at the relationship with kidney. And, what's okay for kidney, because what's okay for other things may or may not be, and found amazing benefits. In the middle of all this, the FDA...
Is BPC 157 oral a benefit as well?
Not as much for kidney.
Okay.
Because, that tends to be... I actually take the integrative peptides, BPC, orally every day and then use the injectable at intervals for the most part. But it's better for the gut, the oral, because it comes from the stomach. It doesn't get broken down, so you can use it for that. But I don't see it as useful in systemic illness.
Okay.
And so,
so what are some of the other peptides that are beneficial besides BPC 157?
The thymus peptides are amazing. And TA1.
Like the thymosin beta 4.
Yeah, the fragment, the thymosin beta 4, 1 to 4, the first 4 amino acids of that are very kidney protecting. I think I'm going to have to go in. All of a sudden, it's like massive here.
Okay.
Well, I'll show you where. Okay, sorry.
No problem.
And while I'm moving, I'll do this is how much I like peptides. My baby was just birthed this week. So I then discovered, I wasn't sure about the growth hormone peptides with kidney. I'm still on the fence about IGF-1 and the role of kidney. I still don't have clarity to be recommending it. ARA 290 is a wonderful tool for kidney.
What is ARA 290?
It's another peptide. Don't ask me what the ARA stands for. I can't remember. And it's typically used for peripheral neuropathy. And I've seen it do incredible things for people with those issues, even sciatica and stuff like that. However, there's a role in the vascular realm. Another one that I've had remarkable success is LL37, which is a anti-infective peptide. And both for self and others, I've been amazed to see like radical improvements and gently placed, because there are concerns with using it haphazardly. And I know a lot of people are. The issue right now is there are limited pharmacies to get these for clinicians who are prescribing.
And they've made it more difficult, right? The FDA.
It's crazy. And so I'm very hopeful that our new HHS person who is aware of peptides might interfere with this interference and change this. But that was kind of where I got off in delight with the Bioregulator peptides, because they are oral and they are supplements. So they're not so far being messed with. And
so for those of us who don't know what bioregulator peptides are, can you explain?
I am glad to. So in the 70s, Vladimir Kovinson, a PhD gerontologist, was in the Russian military, the Soviet military.
Close friend of Putin's. No, just kidding.
And unfortunately, Professor Kovinson passed away. But apparently, I've heard Putin goes and comes out with carton loads of these bioregulators, which are longevity tools. So Kovinson was asked to find ways to protect their soldiers and submarine sailors, I don't know what you call those, from American chemical and radioactive warfare. And he did. He came up with these substances, started looking at the thymus and the pineal, and after a while started looking at them as medical tools. And he was getting enormous amount of funding, had a whole crew. His wife's a pediatrician. And so they did a huge amount of research, which really was just stuck in Russia. And a lot of the research, of course, is in Russian. And so we didn't really know about them. I found out about this not that long ago. Somebody mentioned to me the bioregulator peptide called Pilotax, as in kidney. And so what they are is very tiny fragments of glandulars. So and there's many. There's brain and pineal and eye and thyroid and lung and bronchus and heart and blood vessel and spleen and on and on.
And these are oral?
They are oral.
Are they readily available?
They are readily available. And, you have to know who's producing them. And so there's two main categories. There's synthetic ones where they have taken the 2 to 4 amino acid moiety and reproduced that adequately to use. So they're very clean. The body recognizes it as self. You've probably heard of epitalin. That's one that's become rather popular. That's a 4 amino acid pineal peptide. I think it's on the FDA don't use it list, but endothelial is the actual natural one. So the natural category is refined glandulars. They have more bulk to them. There's the 4 amino acids, and then there's nucleic acids and vitamins and minerals hooked up with it. So typically what the Russians say clinically is the synthetic ones you use first, they have a more immediate, quicker, intense response. And then the other ones are less effective, but longer term. And so there's 100 different ways to go about using these. But, what I've found is every category of these has a hook to the syndrome of kidney. And again, one person might have issues with sleep. And then, the pineal peptides are really useful. Other people might be diabetic. Okay, let's put the pancreatic and the liver and thymus in there. And so, again, it takes that intuitive creativity to know who am I taking care of? What is this?
So if you were going to set up a bioregulator peptide program, it would seem to me you'd probably, at least for sure, want to include the nephropeptides
Pilotax, absolutely.
Right.
I love Pilotax. I pretty much, when I do consults, everybody ends up with Pilotax. And, but again, realize.
And what is the best company to get Pilotax from? Does Integrated Peptides offer that one?
No, I don't think he's doing that quite yet. I know he's got some going, but Profound Health.
Talking about Kent Holtoff.
Yes.
Yeah, he's a friend of mine too.
And Profound Health is really my go-to resource. Okay. It's a pharmacy that
so they've worked directly with. These made from a compounding pharmacy?
No, their product, Nature's Marvels is the product that I like the best. Now, here's something, because I think this podcast is specifically for clinicians. You can get an account through IAS International Anti-Aging Services, and the discount is fabulous.
Okay,
and it's worth having a wholesale account with them. They do drop shipping. So, as a clinician, you can order a protocol of stuff and your patients can get the benefits. I mean, and I know Integrative Peptides is selling some, it's way more expensive. So, and that's an issue because, so when you look at a kidney, there's cartilage. Okay. There's a cartilage, there's blood vessels.
Okay.
There's immune system. There's, parathyroid issues. There's
and
bone
all
marrow
those
issues.
are important for the function of the kidney.
And so what I did with this book was really weave all this together. I started looking at what are the other bioregulators. Oh, this has to do with kidney. And so the book has several sections. One is about alternative mindset of kidney, the stuff we're talking about, heavy metals, microplastics, phosphorus, just the way of thinking about kidney that steps past conventional nephrology. The third section is really the materia medica, where I go through every bioregulator and how they relate to kidney care. And it was really what I needed. I mean, I call this the book I needed. And I've cycled all of these over the last couple of years. And and I've done that with a lot of patients as well. And everybody comes back saying, I feel better. And I did the longevity testing, and, I'm 25 years younger than stated age. So I'm like, okay.
You're talking about the DNA methylation test?
Yeah. Yeah, and telomere length. And, and so, I mean, at one point I had this alarm doing that testing that my CD4 to CD8 ratio was absolutely dreadful. I sort of panicked. I used to do AIDS medicine, and I was like, oh my God. And I used high dose TA1 for a period of time, normalized it.
Oh, okay. And we talking about the true age test? Is that the one you did?
Yeah. Yes.
Cool.
And so there's so many things to do, to neglect kidney. The what are you waiting for was my inner dialogue about it.
I would say, quite frankly, most clinicians don't know what to do with kidney problems. And number two, there's so much fear about the fact that the kidney is this detoxifying organ that anything you put in that could possibly stress out the kidney worse. So you got to be really careful about taking anything that I think a lot of clinicians are kind of scared off from doing much with kidney.
Exactly. And that's kind of why I decided not to be retired and put all this energy into doing this. As a family physician, having one organ to focus on is really a treat. It's like the cherry on top. And the book helped me really put all this together. And so it's a useful guide. It's
and now your experience, your personal experience was you had one of your kidneys removed, correct?
I did, yeah.
Because you had a cancer?
I did. And I was like, how does health food Hannah get cancer? But when I looked at my story, I had been through insane stresses. I mean, just crazy. I mean, my medical practice was embezzled. It was an utter nightmare. A partner assaulted me after a decade. My father got sick, demented and sick and died. My mom freaked out, got sick and died. Blah, 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 blah. All the Holmes Rahe points were up there. And so, it's just interesting. Like, how did I get here? And I didn't get good advice. I mean, I'm sitting here in the middle of nowhere crying out for help. And even really educated, some of my mentors didn't know enough. And so it's really time. I realize, the kidney bone's connected to the eye bone. The kidney bone's connected to the ear bone, to the mouth bone. It's connected to everything. So it's a root cause that we really need to know about.
Yeah.
And it's just
and we didn't mention this, but obviously drinking lots of water is really good for kidneys.
Absolutely. Yeah. Yeah. I mean, hydration is critical. And as people get sicker, when we manage to miss them in our safety net, you can't hydrate as well. And then people end up getting all puffed up and all kinds of things happen. Hyponatremia can happen. But, in the early stages, 1, 2, and 3, it's like optimize hydration.
Right.
And so I look at some of these herbal teas as part of the way to hydrate.
Okay.
It doesn't have, it's like I put Chancapiedra in my tea.
Okay.
I put, my husband's the tea bartender, and he's become an herbalist since we've lived in Hawaii. And, so he goes out and picks stuff. Tulsi grows as a weed in our yard. It's amazing medicine. I mean, there's so many things to do. And my personal, I'm not a good hydrator. I don't think about it. Kidney makes you forget to be hungry and forget to be thirsty. And so it really, there's a mindfulness to this. There's a self-love. If I don't love myself enough to do what I need to do, that's a problem. If I've lost my executive function and I can't, that's a clinician issue to help. And things like DNRS and meditation and breath practices and, all of these tools that we know, with just awareness, know about kidney, and visualize what's kidney, because it's beautiful stuff. It's amazing.
Cool. So I think we're getting to the close. Final thoughts for our listeners?
Final thoughts. I have a website.
Okay.
Renology is kidneysuccess.com. I'm starting to.
Renology is kidneysuccess.com. Okay.
That's my my meme, turning vicious cycles into precious cycles. What was I going to say? The website, it's new to me. I am not a geek, but I'm learning how to put stuff in. So I put my first blog, which was on ozone, because Robert Rowan and Terry Sue were here visiting. And so I got inspired to write up ozone. I have so many things to add. And so that's a resource for learning. You can communicate with me through that website. The book, I think, is a useful tool. It's a research. And
the book tool is titled again, Renology Peptides?
Renology Peptides. Let's see if I can do this too. It's heavy. I'm going to use it for weightlifting.
and is it available through Amazon, Barnes and Noble?
No, it's only available on my website.
Oh, okay.
I decided I didn't want to be meddled with. I don't want opinions. Oh, this book is good. Oh, this book is bad. I'm old-fashioned. It's a hardcover book. You can write in it. It's all bullet points. It's really a lot of information that I'm still looking stuff up in my own book.
So you self-published it, but you actually publish hardcover copies.
Yeah, we used Lulu.
Okay.
My businessman husband has been taking care of all the details, so I don't.
Okay.
I'm not that good at that end of things.
Right.
But it's, I really, I had a lot of people do editing to give me some initial guidance, but I really wanted this to just be like simple clinician guide. And it's a lot of information. And what I found is kidney is not simple.
Right.
And so that's the humbling part that, nephrologists are all like geniuses. And I was totally intimidated by kidney until I was forced to get over it. And what I realized is primary care kidney is what rhinology is what all of us can do to turn this pandemic around, because we can't afford to put all these people on machines or replacement parts. It's not
You're
reasonable.
talking about the pandemic of chronic kidney disease.
Absolutely. And it really is a pandemic. It's huge. It's worldwide. And, other countries do some more creative things because they can't afford to dialyze their population. And it's not, it's like, okay, it might extend life, but it's not a lovely life to live on dialysis or live with a transplant.
Right.
It's a gift, it's a miracle, and yet we can do so much better. We can impact.
That's great. Thank you so much for giving us such valuable information about kidneys, and it's a topic that is really under talked about.
Yeah, truly. Thank you. It's so fun to talk about it, and I'm available for chat through the website, on Facebook. You can find me. I am happy to talk to clinicians and help with cases.
Okay.
I do a lot of that because, sometimes it's like each case is unique. Let's talk about it.
That sounds great. Thank you.
Yay. Thank you so much for everything you do.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.